everyone, I am Dr. Santosh Kumar, Orthopaedic and Joint Replacement Surgeon based in Kolkata, and we have been producing several video series in our YouTube channel so that people who are suffering from these orthopedic issues, they do understand what is their actual problem. They have some insight, some view into their problems, and they can go to correct places for their treatment. And well, let me tell you, if you are going outside, going other places than Kolkata, then think twice. I assure you that the world's best and most advanced in orthopedic surgery is now available in Kolkata, right here in the city of joy. So if you have any issues, please do contact us and come and meet us. We will take all possible ways to help you out, and we will provide you the very best and the safest and the most advanced in orthopedic surgery at the most affordable prices right here in the city of joy, Kolkata. So today we will be discussing about avascular necrosis of the hip joint. Well, avascular necrosis of hip joint is not uncommon in Eastern India and in people of Bangladesh. So people who have been suffering from from avascular necrosis of hip, they need to gain some insight into the problem. Well, first let's make it clear where actually the hip joint is. A lot of people think that the hip joint is the area where our buttocks lie, but that is not hip joint. The gluteal area is not hip joint. Hip joint lies in the groin area. The groin area, the place where the thigh meets the pelvis bone, is the hip joint. It's the largest joint in the body. It's a ball and socket joint. Means there is a ball and there is a cup, so there is a ball and socket joint. Now the hip, this is the femur bone, the thigh bone. It has got a shaft, it has got a neck, and it has got a head. This head is a globular spherical structure which has got blood supply coming from the shaft and the neck. Various arteries go from the neck and give blood supply to this head. Now this blood supply gets jeopardized in several conditions, and that affects the ball, the head of the hip joint, and gradually the cup also. That is known as avascular necrosis of hip joint. That means the death of the head of the hip, the bones of the hip joint, because of compromised blood supply. Now in some cases we know the cause of this compromised blood supply, like it can be a fracture trauma, it can be some medications used like steroids, overuse of alcohol, it can be overuse of analgesics, but in many cases, or let's say in the most of the cases, we may not know what exactly caused this compromise in the blood supply of the head of femur, will leading to avascular necrosis of the hip joint, and that is known as idiopathic AVN, means wherein we do not know the cause of the problem. That is known as idiopathic AVN, avascular necrosis. Now again, to emphasize, what are the symptoms? Like in any arthritis, there is intermittent pain in the groin. You must understand, pain in the groin. There is stiffness in joints. There is limited range of movement, that is, the range of movement gets compromised, and there is limping, painful gait, there is painful limp, and there is difficulty in climbing stairs, difficulty in standing, difficulty in walking, and of course there is intense difficulty in sitting also once the arthritis develops. Now whatever may be the cause of the arthritis in hip joint, the symptoms are more or less same, and the treatment is also more or less similar, that is hip joint replacement. So these symptoms are there in AVN, but it can be in other problems of hip also. The symptoms are more or less same in all the problems affecting the hip joint. Now how this is diagnosed? Once the patient complains of groin pain, what we do is in initial stages, if you want to diagnose in initial stages, we have to do MRI of both hip joints. It is important to do MRI of both hip joints because several cases, or rather most of the cases, it is there present in, if AVN occurs in one side, it may be there, or it will come in the other side also. So better to do an MRI screening of the other side also. So we do an MRI in which we see signal changes, methods to catch early stages of AVN, because once the arthritis develops and it is seen in X-ray, it's already advanced. So if you want to catch it early, we have to do MRI and catch signal changes in the MRI in cases of avascular necrosis of hip, also known as AVN of hip. Now once the AVN develops, once the avascular necrosis develops, it gradually changes into arthritis of the hip joint, which is because of AVN. So once the arthritis develops, it can be seen in X-ray very clearly as sclerotic areas with decreased joint space or fusion, and it can be There are multiple osteophytes can be there. So these are all symptoms, these are all signs which are seen in X-ray, but once it is seen in X-ray, that means it's already in advanced stages. So if you want to catch it early, we have to do an MRI of the hip joint to see early stages of AVN. We have to detect signal changes in the MRI in early stages of AVN. Now this avascular necrosis of hip joint has got stages like early, moderate and advanced stage. In early stages we can see only the signal changes in the MRI and we don't see any collapse, but once it goes into moderate stage, we see flattening of the spherical dome of the weight bearing part. In the weight bearing part, the spherical head flattens, that is in the moderate stage, and in advanced stage it collapses. That is the advanced stage. To be more technical, it is divided into stage 1, 2, 2A, 2B, 2C and then 3 and 4. These are the staging of hip joint avascular necrosis. This is known as Ficataler's staging. This is a more technical way, but more simplistic way to understand would be the early, moderate and advanced stages. And once the arthritis develops, it is clearly seen in X-ray also. But by the time it is seen in X-ray, it is already in advanced stage and it would need hip replacement. So if you want to do treatment in the early stages, you have to do an MRI. Now the treatment of avascular necrosis, it is depending on the stages. So again to emphasize, where is the hip joint? Hip joint is in the groin. This is not the buttock area, this is the groin area, this is the hip joint. So in initial stages there are some pain relieving medications, there are some medications to relieve the neuropathic pain, there is physical therapy exercises and muscle strengthening exercises. Then we go for surgery. In early stages, in stage 1, we can go for stem cells, bone graft, we can go for vascular bone graft and core decompression. And of course, if AVN is affected in very young ages like 10 years, 15 years, 15 years of age, then we have to do derotation osteotomy. What it means is that we shift the weight bearing part of the head and we do to other part, which is more healthy part. And in advanced stages, last stage is joint replacement, which is one of the most predictable, which gives one of the most predictable results in avascular necrosis of hip, and it is joint replacement. Now this, in this we have done an osteotomy, derotation osteotomy. Derotation osteotomy is done in young children wherein AVN has affected, and we want to shift the weight bearing part so that the affected part of the head goes down and the healthy part comes as the weight bearing part to prevent collapse and early arthritis. So, and of course, in early stages in adults we do something called core decompression. We drill and decompress, make a tunnel in the head and neck of the femur to decrease the pressure inside the bone, to increase vascularity, and we put bone graft, which is mostly vascular bone graft. Sometimes we put stem cells so that regrowth can take place and vascularization can take place. But these techniques are not foolproof and they have got sufficiently high failure rate. One of the most predictable ways of treatment of avascular necrosis is joint replacement, in wherein we replace the ball and the cup which is known as total hip replacement. Now we won't be going into the details of total hip replacement as such, because we have already discussed total hip replacement at multiple places. So total hip replacement gives the most predictable results in avascular necrosis and is the treatment of choice in most of the cases. Thank you. If you have any query, you can always email me at santdr@gmail.com or WhatsApp me at 9831 911 584.